Let's try again. You're sharing. I'll just stop sharing and share again.
Sure.
You're seeing my desktop, are you?
Yes, we can see the desktop.
1 second. This may mean starting all over again, I suppose. And I just need to have a little more patience than you think you.
No problem at all.
Yeah. Can you? Is it better?
It's still to play actually. If you can
Yeah.
just continue playing. No, we can't hear anything at all actually.
No, we can't hear, Doctor.
Anything at all. Maybe we can just go through the video and you can give a briefing of what exactly.
Or you do one thing, you just send this clipping, we will
No
circulate
problem. It's okay. I do have a few videos, but the reason I'm showing this movie is that this is not only based on a true story, but it's a good medical drama on organ transplant. And in As Zindagi, since it is a story of our country director and the story came from our foundation, we requested the producer and director to put all the names of all the NGOs working in the cause of organ donation. So all the names of all these NGOs, including the government bodies, are present in this movie called As Zindagi. Rotary at that time, I think, Mr. Goyal, your foundation is there, but Rotary was not formed at that time, so it may not be there.
Yes, please. Yes.
Our Prime Minister also has spoken about, the role of NGOs in the field of organ donation. Our Prime Minister has endorsed organ donation at least 4 times in his Mann Ki Baat. And in one of his first Mann Ki Baat, he says the role of NGOs in this field has been very important. So NGOs as part of this whole program is very, very, significant. And as far as NGOs are concerned, we not only create awareness, but we look at more towards donation, to increase the donation in the country. And to us, the real heroes are the organ donors. This is a young child who underwent a kidney transplant. And he says that ever since he has given me a kidney, he can run, he can play in his school. He is a real hero. So the real heroes in this program are organ donors. And this is a clip I'm showing you from Rajasthan. We have an office in Rajasthan where we do, counseling in the hospitals. And this is a clip from Rajasthan. I know it's a little tilted, but these are ladies who are come to grieve, not in black like the English do, all in color. And this is the gentleman, and he's saying he is not dead, he's alive. He's alive in many people. And that is the power of organ donation. It connects everybody. We have a law in our country called Transplant Law, Transplantation of Human Organ Act, which was passed in 1995. I think organ donation is the only medical condition on which we have a separate law in this country. And this law underwent some amendment also. The reason for this law was not to, increase organ donation. The reason for this law was to curb organ commerce in this country. Because Indian surgeons were very skilled when organ transplant started in the 80s, and the cost of transplant was less in India. So rich patients from Middle East started coming to India, started exploiting our poverty, and a black market for kidney emerged. And this brought a lot of disrepute to India. This was in 70s and 80s. And this is the reason why our law came. The law came to recognize brain death as death, where you could do organ donation of not only kidneys, but other organs like liver, heart, pancreas, intestine, all the whole body to be recycled. And organ from living person was only allowed among related or remotely related. And all regulatory framework rules were framed around this. So the law came because of organ to stop organ commerce. When the law was passed, many people felt that in India it will never work because we are a multicultural society. Brain death will never be accepted by people and by doctors. And in the early years, championing this cause was very difficult. Very few people trying to champion this cause. So law was passed in 95. From 95 to 97, there are only 4 institutions in this country, hospitals which are doing disease donation or cadaver transplant. And that included my hospital called Sri Ramachandra Medical College. I had just returned from England in 95 when the law was passed, and I was trained in disease donation. So I felt that we could do disease donation in India too. And that's how I started this transplant program in my hospital with disease donation. Many of my initial transplants were from disease donors, because I wanted to know whether I can, whether, these detractors who say that it is not possible, I wanted to know whether it is true. So I thought I should try and run this program in my own hospital and see all the challenges. So there are 3 hospitals in Chennai and 1 hospital in Delhi doing cadaver donations. In 1997, we formed the Mohan Foundation because we felt that there is a need for a support group. And I'll tell you a little bit about the foundation as we go forward, because I think Mohan Foundation is the mother foundation for all the NGOs working in the field of organ donation, because we do 360 degrees kind of work in this field. So the concept of organ sharing between hospitals in Tamil Nadu, we first started in 1999, and it was based on the wishes of disease donor families. These are families. This is a function in 1999 we held in a college called Loyola College. And we called the families who had donated organs in Chennai and in Tamil Nadu. Surprisingly, we had a family from US who had donated organs of their mother. This is Nancy and John, who came all the way from US when they heard that we are going to honor the donor families. And they had donated the organs of their mother because she had died in a road traffic accident, in a bus accident, and he came all the way from the US. And this is me. I have grown old with this program, as you see. This is 1997. And it was in this memorial service that many families expressed that, they didn't know where the organs went, how the hospitals, distributed the organs. And this is the other kind of, wishes. We started this organ sharing concepts in Tamil Nadu. And we laid this plaque in front of the church of Loyola College, which is still there. And we planted saplings in the memory of organ donors, and these have become very big trees now, of course. So this is how the sharing kind of concepts of organ started in the country. And this is our organ sharing network we formed in 1999 between 4 hospitals, and then more hospitals joined. And the ethos of this whole principle was not to waste any organs and treat them like national resource. Soon we also had an office in Andhra Pradesh where Lalita Raghuram joined. And in about 8 years of organ sharing, we had shared about 600 odd organs in the 2 states. The potential for organ donation in India is huge from disease donors. We have 8.4 million deaths every year. 1 to 4% of such deaths are from brain death. Why I say that? Because we have, chaotic roads. We have a lot of people dying on the road due to head injury. And we have 400 deaths in any day. 147,000 fatal deaths due to road traffic accidents every year. Of these, almost 67% have head injury. So an estimate that there are 95,000 brain injuries in this country. So the potential for organ donation is huge in this country. We don't even convert 1% of our brain death into actual organ donors. The reason for low donation rate, there are societal issues, a lack of awareness, where NGOs play a big role in creating awareness. There's religious and cultural barriers to some extent, not too large. But the bigger problem is also there is mistrust in healthcare system, because our healthcare is mostly in private domain, not so much in government domain. Most of the transplants, 80% of transplants happen in private hospitals. Only 20% happens in government hospitals. There's also hospital issues. There are barriers in hospitals. There's knowledge of, organ donation, brain death among doctors also is very poor. There's also no standard operating procedures in hospitals laid out for when there's a potential organ donor. There's also families lack support in the time of grief. They don't get support from the hospital to take a decision to donate organs. The pathway for organ donation can be quite complex. You need to identify a brain death first in the ICU. The brain death needs to be optimized. It needs to be certified. Consent of family needs to be taken. Then various stakeholders who are going to, various hospitals which get the organs, somebody will get the heart, lung, liver, pancreas, they need to be communicated. How the organs are going to be distributed, the central or state authority needs to be communicated, which is in charge of distribution of organs. Then the organs needs to be taken out, and then there needs to be post-donation follow-up. So the key here is family consent. The key here is identification and certification of optimization of brain death donor. And both these things don't happen in our hospitals. And that's why we don't have any, our donation rate is so low. So from the time a person suffers brain injury due to an accident, loses consciousness, is taken to hospital, till the body is handed over, if there is a donation happens, the family, there are multiple procedures, multiple steps. I'm not going to go through this busy slide, but there are multiple steps involved. And this is where we have system failure in this country. So from 1995 to 2014, the whole donation program in this country, we had although law had been passed, but there was no central body or state body which was running this program. And nobody knew who this program belongs to. And this is where we were playing a role as an NGO, large role, to try and, keep the ray of hope alive for this donation to happen. And then the government in 2014, in their rules, came up with Noto, Roto, and Soto, which started into operation in 2016-17. There's always this confusion in our country. There are 3 or 4 different models in organ donation which can be followed. The presumed consent model of Spain, where everybody is supposed to be a donor unless otherwise they express, or the American model or the British model. So there are 3 distinct models which can be followed. But what we needed was to create an Indian model to adopt the best practices. We can't follow a Spanish model because we are such a diverse country. The British model is different, and so is the American. So we needed to follow an Indian model. This is a small video, again, to show you.
Struggling with an acute organ shortage. It has one of the poorest organ donations in the world.
Can you hear this?
Sound. Yes,
Yes,
we can
yes,
hear the
please.
sound well.
Yes, we can hear.
Thank you.
Now we can't. If it's playing now, we can't.
So, we do a lot of awareness, we do a lot of capacity building. Training is one of the forte of the foundation. During organ donation day, we put the buildings in different, cities where we have offices. We try and get them to become green because green is the color of organ donation. This is Jaipur. In Jaipur also, a street has been named after the name of organ donor. This is first of its kind in the country. We also felicitate donor families. We have created a donor memorial in Jaipur. If you go to Jaipur, in front of the SMS Medical College, it's a beautiful donor memorial in the memory of donors. And we also get, engage celebrities to endorse organ donation. This is Ravina Tandon signing off and saying, I support organ donation and save lives. We do get opinion leaders, celebrities. And I had the fortune of also appearing in Kaun Banega Crorepati with Mr. Bachchan. So this is the first time the whole set of Kaun Banega Crorepati became green in color of organ donation. I think it never happened before. Well, when they approached me, one of my requests to appear on the program was that we should do something different, and they agreed to make the set green, because green being the color of organ donation. We feel that training is the key to success of the whole program in this country of disease donation, and that's why we are, besides awareness, we pay a lot of spend a lot of energy towards training, and we train ICU consultants and medical and professionals, nurses. We train coordinators so that they can support the family during the time of grief. We train the police because in medical legal cases, they are the ones who are the stakeholders. We also train surgeons on how to retrieve organs. And we have a tie-up with Oxford. We have a tie-up with NHSBT of the UK. NHS National Health Service is the largest government organization in health services. So we do have a tie-up with them. And the impact of one of our surgical training, which we've been doing, has been huge. And there have been surgeons who have never seen a heart transplant come to a training program and gone back and done heart transplant. This is Dr. Ratnavelu from Madurai Medical College. He came to the training program and he started doing heart transplants. This training program we do with NHSBT, Oxford Group, and the Liver Transplant Foundation of Dr. Sunal Asthana. Together, we do this program in Bangalore in MS Ramaiah Medical College. We also train ICU doctors because for maintaining brain death, you need to train these doctors. We teach them about the communications, teach them about organ donation pathways. Training of coordinators is a very important aspect of our program, which we do. And this has resulted in a lot of donations. This is an example of training which we do in Tamil Nadu. And we have an MOU with Rajiv Gandhi Government General Hospital, which we signed in 2010. And if you see the result of putting coordinators and training of coordinators in this hospital, in 10 years, they had certified 299 brain deaths. Our counselors approached 291 families, and we got yes from 198 families. And we had 136 multiple donors who said yes, a conversion rate of 66%. And just from one hospital, so many organs came. And, this is just one hospital in a large city. In fact, one of our heart transplant recipient took up the training of a coordinator after she got a heart transplant in Chennai. This girl is from Bombay. Her name is Haovi. Our training modules are quite, well taken. Now I'll just show you briefly. Our training modules consist of text, graphics, well explained. And these are, videos which we use for training on brain death, or the science of brain death, and these are very interactive. So, is what I said by interactive. They have to fill in these videos are not just, you just can't see them just as is. You have to interact with it, answer questions, and only then you'll go forward. And so these have been done with a very high quality. And this is, I must say, thanks to Tata Trust support to us to develop some of these training modules. So this you see is an interactive training module where they have to answer questions in a video before it goes forward. I'm just showing you examples in case anyone is interested in, scaling up their skills and wanting to take up such courses. They're all available online. These are lectures done on green mat again, and these are on these lectures are available on our online training program. And then there is also assessment through MCQs before they get a certificate. One of the important training programs is the counseling, which is done for the for the transplant coordinator, and these are simulation videos done by actors.
No, the sound is not there, doctor.
Sorry. So I'm just trying to show you that these are all available in
Yeah.
our courses, which are there online. And these courses, not only from India, but people from all over the world are now starting to take these courses because the cost is so less compared to the courses available in the West. So in fact, courses from Spain are very famous, but even people from Spain have come for our courses. The only reason being that, the cost is so less in our country for our courses. One thing which I would like to actively promote to you people from Rotary is our online volunteer training program for organ donation. We call them organ donation ambassadors. And this program we started in COVID because we couldn't go out there to promote organ donation. So we started this program in COVID. And one of the things is when we go for promoting organ donation, the information which we need to give should be absolutely right to the public. And that's why we feel that this program is very important. And this could be, a program which you should think of also taking this. There's an online registration process. And then again, I have a video. This should be quite simple. Four aspects: basics, legal, ethical, how to do donation. Covers many things as and then there is certificate and assessment. Again, excellent feedback. And the fee is very nominal, 500 rupees, free to donor families or somebody who's unaffordable. So these courses are well formulated. The master's program consists of 3 modules. First is the online gift of life course, which takes about 4 hours. So this has introduction to basic concepts, ethical issues, tissue voluntary donation, and so on. Then there is an activity where they meet stakeholders for 2 hours. They meet, doctors, they meet recipients, they meet donors, and then they become volunteers, go out there and do the activity. And I'll show you what happens. There are also supplementary modules for, taking up, if you want to know how to take care of your kidney and so on, there are supplementary modules as well. And in these modules, we have also used gamification and so on. Anyway, so, and the course rating has been excellent for these courses. Most of them have agreed that these courses have been very effective. The module 2 is very interactive. This is an online-based activity done on Zoom, where they meet, as I said, surgeons, coordinators, recipients, donors. There's storytelling. There are tips on how to make presentations to the public. There's mentoring for volunteers. And then they do a letter of gratitude. We make them write a letter. If they have received an organ, how will they write thank you letter to a donor family? So they do a letter of gratitude as well. And then after this, we tell them to go out there and do, awareness on organ donation. We verify their content. We provide them with collaterals, clear their doubts. We give them ongoing support, and their activities and photographs are posted on social media, and they are given certificates of award. So far, We have trained about 429 such ambassadors. They have been from all over the country and some from abroad as well. Most of them are college students. There are also, NGO representatives, school students, independent people taking up. Of the 429 we have trained so far, 109 are very active in this field all over the country again. And these are some of our ambassadors. They have done some amazing work. This gentleman went all around the country solo, driving his car, creating awareness on organ donation. This gentleman walked around Narmada River, 1,800 kilometers to create awareness on organ donation. And Sandhya, of course, is a big champion. She conducted awareness rally with 16,000 women simultaneously in 218 cities in the country to set up some Guinness Book of Record. So they really walk the talk. And this is one program which I would strongly encourage, if you're interested as Rotary Club, your volunteers, to try and think about taking up this program so that they get empowered with the right information. We also have this life gift support program, which we're running. We have a patient support group called Triumph, which again, is led by Jaya Jairam, who herself is a kidney recipient from Bombay, where they meet on one platform and they discuss their stories, they share their stories. And from this came out this program called Anudan, where we try and help families who are not affordable for transplant to provide financial assistance. We started in 2021, again during COVID. After Triumph was found to be very successful. And in this program, we have so far dispensed about 70 lakh rupees for transplant, in which we have had 27 liver transplants, 7 kidney transplants, and 5 corneal transplants. Many pediatric, many women have been, helped for giving them resources. So what we do is we tie up with a crowdfunding platform. We give them a little bit of our money, and we try and get the rest of the money from, the crowdfunding platform and other NGOs. And then we also try and negotiate the right price for a transplant, bring down the price of a transplant from a private hospital. Now we have, this is one of the recipients, Nivesh, who received a liver transplant. So there are some good stories of success for the foundation. We are proud of Tamil Nadu, where we started in 2000. Tamil Nadu is one of the leaders in the program. Recently, we also did donations in Imphal, in Manipur, and in Rohtak in Haryana. These are some of the success stories. These are some of our transplant registries which we've done. This is the Tamil Nadu registry, where they have done close to 9,000 odd transplants. This is the donation which happened in Imphal. We have done so far, 3 disease donations in Imphal despite the disturbance. This is being supported by SBI Foundation. We have 2 coordinators placed in a government hospital. Currently, India has, close to about 6 families which say yes to donation, which results in 3 organ donation, solid organ donation, which takes place. This is a green corridor video. Let me show you this video. This is a van carrying a heart, across to another hospital. And if you see how people will be throwing flowers on this car because there's such a good fill factor. We personally now feel that we need to have green corridors within the hospital. We feel the public is very giving. If we give them a good support during the time of grief, our conversion rate is fairly high. This is my foundation. I acknowledge the team. Lalita Raghuram is country director. She's in Hyderabad. Pallavi is in Delhi. Sudhir, Lalita herself is, as I said, donor family. She's the one on whom the Air Zindagi movie was made. Sudhir Diwan is a liver recipient. He got his liver from his son-in-law. This Ravi Wankade is in Nagpur. He is a kidney donor. He donated his kidney to a friend who happened to be a Muslim. Jaya Jairam is our project director from Mumbai, and she herself is a kidney recipient. Bhavna Jagwani is our person from Jaipur. She also has had problem with her eyes during her pregnancy. So great champions. I'm just a small, spoke in the whole wheel of organ donation of the foundation. I thank a lot of our partners, be it the central government, Noto, Tamil Nadu, Telangana, Maharashtra, Haryana, Kerala, Karnataka, Rajasthan, Manipur, Andhra Pradesh, private institution, healthcare sector, corporates, they are all our collaborators. We also have offices in England, US, Netherlands, You know, we also on the UN consultative status, and we also are doing. We have an association with Commonwealth Tribute to Life. In fact, if you are in Delhi from 22nd to 24th of March, we have a second international meeting which we are organizing with Commonwealth, 54 countries, called Tribute to Life, to bring the best practices in the field of organ donation. We have been recognized by awards for the work which the foundation has done. And I am driven by Joseph Murray, who did the first successful kidney transplant in the world. And he got a Nobel Prize in 1990. And he said, service to the society is the rent we pay for living on this planet. So thank you, Mr. Goyal. Thank you, Rotary Club. Thank you, ladies and gentlemen.
Thank you very much, Dr. Shroff, for giving such a enlightening presentation. Although there is sound problem, but in spite of that, I am sure that everyone has understood your mission, the way you are doing it. And I would like to tell our members as well as the viewers, because it's a live telecast, that Dr. Shroff is not only doing it in India, everywhere in the world, and he's always there to support any NGO who wants to come out for this organ donation. Now, before I will open the floor for the questions from our other members, I have a question for you, Dr. Shroff. Recently, you might have read in the newspaper, the Odisha Chief Minister has given 5 lakhs rupees, and he declared that all the organ donors' families will be given 5 lakhs rupees apart from the estate owner. Now, there is lots of controversy going on, because estate owner is fine because you are giving something, but giving the money 5 lakhs rupees and declaring it that it will be given to everyone, don't you think it is against the principle of organ donation as well as against the laws which were formed by the Parliament Act? What is your opinion about this, Dr. Shroff?
I think, it's not to be done. It shouldn't be done. It's not something right. Ethically, it is very challenging. Because what you're doing is you're actually giving inducement. If you give inducement and get donation, then it is like, putting a price on an organ. Because organ donation is very noble. It is, something which should come from within. It shouldn't be forced on anybody.
Okay.
And when you kind of force somebody by giving them a carrot, dangle them money, it becomes a big issue, which means that, just to encourage donations, you're inducing them and giving them this, kind of carrot, extra carrot. I think, I don't know how many members of your members feel it is right, but I think we have to be very careful in this country. It's very slippery slope. Today you're talking about 5 lakhs. Then the family will say, I want 10 lakhs. Somebody will say, I want 20 lakhs.
And then the broking will start, because then NGO's role will become like a broker, because that we are going to get you this much money, please donate. So this is a very controversial thing, and already I have received 2-3 calls from different NGOs and others. So I am planning to keep a program not under the Rotary banner, but in a foundation where we will have discussions among ourselves before writing to the government of India and the state governments, not to start this practice, otherwise there is no end to it. Thank you very much.
What you can do is you can give them some indirect incentives, in the sense that if there is somebody who in their family has an organ failure, then they can be given a higher priority in the list for getting a transplant in the disease donor.
Plus children can be given in education the scholarships, railway concessions. Absolutely. Or that is fine, but giving cash thing is
dangerous. Cash is dangerous. Then bidding war will start.
Yes.
Okay.
So thank you. Now, any of our members who wants to ask the question to Dr. Shroff, please. Any of the member who is interested to ask a question?
Dr. Shroff, I'm Ramin Goyal. I'm a surgeon in Mumbai. I'm not related to organ transplant at all, but in this Rotary club, there's some discussion going on about supporting poorer recipient financially. During your presentation, you mentioned about that you could talk to the hospitals and you could bring down their
Got it.
costs. So how is that possible, and what is that percentage of reduction when a NGO approaches the hospital and says this is a poor person, and instead of charging 100%, you charge. So what would be that percentage into?
So it varies from case to case, and it is no fixed kind of thing, but we try and get them down as much as possible. It varies from hospital to hospital. It basically, what happens is there are some doctors who we are in close contact with, who know that our NGO helps. So they contact us first by saying that I have a patient who requires help. Can you help them? And then we get there, we validate the whole history and look at the whole case, and then we take by case, and then we make sure that the money which we donated is given rightly, in the sense that we try and bring down the cost from the surgeons, like surgeon's fee, let's say. A surgical fee can be as much as 50,000 to, let's say, 2 lakhs. So that fee can be brought down. The hospital charges can be brought down. So a price can be negotiated with the hospital. And very often the hospital will give the package, let's say 5 lakhs, let's say. So the hospital will bring down the price by, let's say, lakh. So we are able to negotiate a better price that way when we go as an upfront. But I can't give you a formula that 10%, 20% that way.
Yeah.
There's a whole procedure to that. And in fact, Jaya Jairam in Bombay is leading that. We have a separate team for that. They do verification of the documents first. They look at their financial, not only for the transplant, but afterwards, whether they can afford the medication post-transplant, because post-transplant medication can be 5,000 to 10,000 rupees. So what the affordability is, there's just no point just doing a transplant. If post-transplant, if they don't take the medication, the organ will get rejected. So we look at the whole, what's the actual situation on the ground, and we try and take care of that, and then they can take a decision. And mostly, the request comes for children, for women, who are if you look at the donation rate and the transplant, most of transplant, about 80% or 70 to 80% of transplant are done to men. So we are trying to see, this equity gap, this gender gap. We are trying to, help. Not, of course, obviously, our numbers are not large, but we feel that we should try and give more preference to women and children when it comes to actual requirement of finances.
Okay, thank you.
Any other question, please? Yeah.
So I would like to ask a question. Somewhere
sir.
in your presentation, you had mentioned about the percentages of transplants happening in private hospitals versus government hospitals. So that
Yes,
was
Ritika.
80-20.
Yes.
Yes. So does it have anything to do with the price of the entire procedure, or the facilities, or what exactly is this? Or basically, is it the higher cadre of society which is going for it, which choose to probably get operated in the private hospital rather than the government one?
What has happened, actually, this is a larger problem, Ritika, of healthcare in India. The GDP of government in healthcare is less than 1%. We spend close to 475,000 lakhs on defense, but expenditure on health is mere about 60,000 crores. So the difference is huge. So this is a larger problem of government's kind of commitment to healthcare in the last 25, 30 years. The COVID actually woke up the government, and our healthcare has now got a little bit more from the government. Now the government's GDP on healthcare is more than 1%, but the private GDP in healthcare is more than 5%. So what has happened is gradually healthcare has generally shifted from the government towards the private healthcare. That's the problem. So it's a bigger problem. It's not that the government hospitals cannot do transplants. In fact, the PMJ scheme gives 5 lakhs. The Tamil Nadu government gives 20 lakhs for liver transplant to any hospital, which does a transplant for somebody who's not affordable. So in a way, what they are trying to do is they are trying to, instead of doing it in their own, I'm not trying to criticize them, but instead of doing it in their own premises, they are giving it to the private people to spend, to be given 5 lakhs to 20 lakhs for the various transplants, which we find is a little peculiar, because that resources can be pumped back in the government hospitals to develop the infrastructure, develop transplants in the government sector, so that the less affordable also can get a transplant. This equity has to shift. If we want to get trust back into healthcare, we need to shift this equity back so that the less affordable also can get not only transplant, but let's say hip replacement surgery, heart surgeries. These are all high-end surgeries. These are expensive surgeries. So these surgeries should be available in tertiary care government hospitals. And this hopefully will shift in the next 5 to 10 years, because government is coming up in a big way trying to help now to the healthcare, in the country after the COVID.
Yeah,
And do
Dr.
you
Shroff,
think
I would
the
like to.
shift towards
Sorry.
the private sector is going to continue going forward, or there's going to be like a
So this is a little complex question, Ritika. The thing is, India being a sector where the cost of healthcare is low, and the private hospitals are doing, the private hospitals are like 5-star. Some of them are like 5-star hotels. So a lot of foreign tourists are coming to India, like from Africa and other countries, rather than going to the countries which are more expensive. They come to India for treatment. So we have a big influx of foreigners, which is pumping up the private hospitals' growth in this country. So it's a bit complex question, and so the government really needs to take care of it and make sure. It's not that the government doesn't have funds; they just need to get their house in order. To be
they
honest,
need to delegate it.
But Dr. Shroff, I would like to just tell you, if you remember, I don't know whether you were in that program or not. In one of our media conference with Lal Goel, this question was raised, and I asked that 5 lakhs is nothing for the liver or any other transplant except the kidney. And one of our panelists, Dr. C.V. Anand Bose, who is right now the governor of West Bengal, he was also there in that program, and he wanted the clipping which he has sent to the Prime Minister, Honorable Prime Minister. And now the Ayushman Bharat in the this thing, transplant 15 lakhs rupees the limit only for the BPL category, but it is now increased to 15 lakhs rupees. But very few people are aware about this. So
very true, very true.
That is
actually the different governments, state government give different kind of cost to the private hospitals. Tamil Nadu gives 20 lakhs, up to 20 lakhs for liver and heart transplants to the government to the private hospitals. So, this is a little different discussion, but, interesting question. I think, give it another 5-10 years, health insurance also is coming in big way. There will be a little bit of shift towards the government sector.
And as far as insurance, as you mentioned, only 1 lakh rupees is mentioned in my policy, which I have seen, that it is for the organ donation. So it's nothing in comparison to. Yeah.
Nothing.
So anyway, so thank you very much, Dr. Shroff, for attending. I think we should go for the vote of thanks or any other questions. Otherwise, we should go for the vote of thanks.
Okay, Dr. Rohan Monis. Yes, please go ahead.
Yeah, you have a question? Yes, Dr. Monis.
So good evening, Professor Shroff. Beautiful and very exciting presentation to see there's a huge learning curve. So what we understood is it's been about 25 years since the Mohan Foundation has taken some amazing or drastic or any interventional steps. So is there any mode that we see in the next 10-15 years that the rules will be relaxed, wherein we can talk about organ donations or organ donations can happen more frequently? Because there are a lot of state level.
I see the living transplant. I think, India has got a huge problem with diabetes and hypertension, and many families have if you are a young person donating, and if you suffer from hypertension and diabetes, the chances of organ failure is high. So in India, we are, actually at a higher risk as a living person to donate. So the only way forward is disease donation. And we really need to push this as much as we can. And as time goes, I think we have improved. In 2012, we just did about 200 donations. In 2023, we have done close to 1,068 donations. So we have gone up 5 times in 10 years. So hopefully another 5 years, we'll be doing close to 5,000 to 10,000 donations. And that will give rise to a lot of organs. So give it some more time. And if people like Rotaries and others join together, and Prime Minister has talked about organ donation 4 times, as I said, I think organ donation is at the center stage. This is the right time to be in this field. And in time to come, I think, Dr. Rohan, you will see more donations happening.
I think Mr.
Purushottam Pawar.
Purushottam Pawar would like to ask.
Yeah.
Yes, sir.
Dr. Shroff, you rightly, everybody is against the remuneration of 5 lakh rupees. According to you, how we NGOs should approach and how we should protest?
How we should protest?
Yeah, means individually or unitedly?
we should see, if we work together, we are stronger, just like 5 fingers and this. We have to work together, all as NGOs. And then we are a voice, a strong voice. And then we are very, so we should work together and we should protest because, as I said, NGOs are the conscious keeper of the society, believe me. And we can do it. If the law doesn't permit this to be done, if somebody just files a case in the court, the government will have to back off. So we need to keep this program as big as possible. And as NGOs, we should work together. If somebody takes the initiative, everybody should support each other.
Thank you very much.
Thank you.
Yes, I think the vote of thanks, please.
Yeah.
I
What
request,
fantastic.
Sure,
Yeah.
please go ahead.
Yeah. What fantastic presentation has been made by Dr. Shroff. 3 cheers to Dr. Shroff and the Mohan Foundation. I would like to express my sincere gratitude and thanks to Professor Dr. Shroff, trustee of the Mohan Foundation, for joining us today and sharing his invaluable insight on the organ donation. The Mohan Foundation has been instrumental in saving countless lives in India by promoting deceased organ donation and facilitating transplant processes. Their work in the raising awareness, training, healthcare professional, and supporting family has made a significant impact on this. As we address the international need for organ donation, because the gap is very, very, very significant, let us be inspired by the success of Mohan Foundation. Their model of collaboration, education, and advocacy can be adopted by all, including Rotary International and culture. By working together, we can really create a world where everyone has access to life-saving gift of the organ donation. Thank you, Dr. Shroff, once again, and 3 cheers to you. Thank you very much.
Thank you.
Thank you very much, Dr. Shroff. And meeting is